My name's Phil Wakefield, and I work in an area called medical communications, which is essentially helping to give a voice to patients, but also I work quite extensively with the pharmaceutical industry and help in terms of, similar to Barclay's conversation earlier, about bringing drugs through to patients, but also in the area of educating healthcare professionals, particularly in regard to diseases and particularly with respect to rare diseases where obviously information and experience might be much lower. In terms of my background, I did scientific research as an undergraduate, so I was fortunate enough to win an award to study for a PhD, and I was researching in Duchenne muscular dystrophy. So I guess that was my first exposure to rare diseases. And this is the young boys who have a muscle wasting disease. It affects about 1 in 3,500. The parents don't usually find out until they're about 2 or 3 years old. So it's a very, very devastating condition. So I learned a lot from the research in that area, and then decided I wanted to do more to try and help patients and try and do more in regard to bringing new treatments to markets. So we're going to talk a little bit this afternoon about patient advocacy and how, even if we do the littlest things, it can make a really big difference, particularly in areas of rare disease. By popping up a statement, has anybody seen that statement? Anyone want to volunteer what that means and where it came from? Yes. Yeah, it was a government program that was set up, I think back in about 2010, where there was a real push to ensure that the patient voice was heard. The knowledge that sits with you people here, you obviously have the first-hand experience, and it's not just about the underlying molecular pathophysiology behind the disease, it's what's happening on a day-to-day basis. What are your experiences like? How do you feel? How is it impacting you? And I think, I'm sure Barclay would have referenced this just before lunch, that can be incredibly important in putting together evidence to gain approval for new treatments. So really, you are the experts. You've got that first-hand knowledge of how it's affecting yourselves or people who you may be caring for, how it affects the community, how it impacts within a hospital environment, those kind of inefficiencies that are involved by people not thoroughly understanding the condition itself and the treatment that's needed. The day-to-day burden, how it's affecting you, and again, I think you mentioned it here, you become the experts because you will have done a lot of the research and reading in this area, and you've got a real understanding of what those unmet needs are and how you're not being helped perhaps as effectively as you could be. And what's really important, and we've put it up here, is in that collective experience and about giving a slightly louder voice to those individual experiences that you have. And that's what I'd like to talk about over the next 30 minutes or so, what you can all do at an individual level to help raise awareness, but critically, what you can do as part of an organisation. And I know we have Jill here, who I'm sure will talk a little bit more about this as well, but it's when we collect those voices together that they become even more powerful. And these are some of the opportunities for involvement, and I'm sure you'll have heard some of this from Barclay around reimbursement decision making and the decisions that get made by regulatory bodies when it comes to bringing new treatments through and the kind of information that's needed there. I work in a couple of areas. I work in severe asthma and I work in chronic heart failure. And severe asthma, talking about the very extreme end of the scale, so these are this like 3 to 5% of patients in whom inhalers just don't work. And unfortunately, they tend to get classified with everybody else who has asthma and ignored, or they're sent away with steroids and go told to look after themselves essentially. And what we've looked at doing is undertaking surveys, for example, to get a consensus of opinion that actually this treatment is not working. So it's extremely powerful, and those kind of information can be taken, as I'm sure Barclay mentioned, to some of these regulatory authorities to try and push awareness of these types of conditions a little bit higher up political agendas. That all sounds very scary and very involved, but it starts at very, very small actions that can be undertaken. And this is particularly in the area of education, involvement in conferences and workshops, and I'm going to talk about those in a little while as well. There's some other pieces here, and I guess one message I always encourage you, if you do receive a survey or if Jill is involved in preparing a survey, make sure you fill it in, and make sure you fill it in honestly. I've worked in haemophilia, wherein what happens is the haemophiliac patients, so those that have uncontrolled bleeding, it becomes very normalised and it becomes almost normal behaviour that a bleed, well, that's okay, that just happens. And we have to remind ourselves that that's not normal. And it really can be quite uncomfortable and quite painful for these patients. And interestingly, there was some of these surveys found out that there's a real discrepancy between how the doctor understood that condition and what their impression was, and it was at complete odds to how the patient, and the patient was actually suffering quite a lot of joint pain that the doctors just didn't feel was there at all. So these surveys really help to alert to that fact. In terms of how can we be involved as an individual, I'm just going to share a quick story first in the area of workshops and educational meetings. Story first, educational meetings, because there's a number of areas that we can become involved in. I'm going to go through each of these in turn, but just to start, oh actually, no I'm not, let me tell you about this story, it's going to come up in a moment. We work in a condition, neuromyelitis optica, which is a very, very rare disease which mimics multiple sclerosis. And it's a condition of the eye and the spinal cord, and what happens is if it's untreated, it eventually can lead to paralysis, can lead to blindness. And unfortunately, what tends to happen is you get diagnosed as multiple sclerosis and start undertaking treatment for MS, but the treatments for MS can actually impact those NMO treatments in a bad way. So really, that's really not the course of action that could be taken. And so there was a lady whose son had NMO, and she went to her paediatrician and started talking about the condition. She had done a lot of the research, and he ended up inviting her into the hospital to run a little lunch and learn session with some of his colleagues. So she had the opportunity to start educating the hospital team and the staff, and to start raising awareness. And so it was a very, very simple thing. It wasn't scary in any way. She literally sat down, table like this, they had lunch together, and she just talked about the condition and talked about what kind of treatments were available and how better people could be diagnosed, and to start raising that awareness. So, taking this example here, in terms of fundraising, has anyone been involved in fundraising? Has anybody done anything as yet?
Yeah, not through medical things.
So what did you do?
Our local church has a charity that takes people to Lourdes in France, and so we raise money for that.
Fantastic.
Okay.
Fantastic. Because I guess it's twofold, because it is about the raising money, and of course that is invaluable, but it is also about raising that awareness and trying to get a bit more knowledge out there. And I think this is particularly the case with rare diseases, that the information just isn't out there and people are not aware of how serious these conditions can be. So some of the barriers to this, and this is quite a straightforward one, and there's lots of help, I'm sure, with some of the organisations and online that you can see. But sometimes there is that, well, I don't really know where to start. I don't really have the material or the information. I haven't got the connections as to how I can get this off the ground. But I think it is things that Jill's organisation can assist with. I'm going to share a couple of websites with you towards the end of this presentation where they have ready-made materials for you, and they have ideas of things that you can do. And I think particularly in this area is, the day in the life of diet, and challenge some of people that you know, can you go a day with this type of diet? And there's some quite nice ideas that you can link directly into this area to help raise awareness about that. It's why it's so important. So NICE submissions will take data because oftentimes it's not just about the efficacy of a new or how effective a new treatment is. It can be about fully understanding the burden of a condition. That's not just to say how much it costs, but it's all of the different healthcare associations, so how it might impact the healthcare team that's involved, how it's impacting you as an individual. Does it impact you in terms of working? And there are lots of things outside the pure efficacy of a treatment that are very important for those submissions. So patient registries can help to collate this kind of information. So I strongly recommend that once that is up and running, you all get involved with that, because it's a very, very simple thing that you can do. Volunteering of any skill sets that you might have, particularly if patient organisations are starting to get up and running and you're starting to make connections as a community, and you're quite a manageable community. I understand there's probably between 60 and 90 in the UK. So it's a manageable number. So you might have some skill sets that can help. So maybe some of the maybe some of the younger people might have experience with website development or IT skills, but equally experience or passions with regard to writing, creation of materials, and oftentimes patient education materials will be created, and sometimes not even a patient is asked about those. So you can really help in terms of lending your experiences to make sure that these really work well and are really valuable. You may have some people who have a passion for presentation. And again, you can put your hand up and become involved with Jill and her team, because I'm sure, as some of you have had little film slots done earlier before lunch or throughout the day, there's always an opportunity to speak and to share that more widely. And I know Simon's going to talk about this once I've finished and how we can do that a bit more readily. But you can go online and view patient blogging. Has anybody put anything online at the moment? Possibly not.
The Alliance website.
Yeah. But you can go on and you can see there are individuals, and I use some actually in training purposes, but you can find it on YouTube, and Simon will tell you it's so much easier to do nowadays, and it's such an accessible way to share your stories. I'm talking a little bit more about how we share stories in a moment. So just think about anything that you can bring, anything that you're interested in, passionate about, that might help. And I go back, because it is a small community, so I'm under the impression it probably needs all the help that anyone can give, in as much as you, I'm getting furious nodding from Jill, in as much as you can do. And once you start doing it, it becomes quite fun. And I think particularly with regard to, this is always a scary one, presentation and standing up and talking to people. But the more you do it, the easier it becomes and the more fun it becomes. And it's extremely valuable. I talked about that NMO example with regard to the workshop or the educational meeting, and it sounds a bit scary when I say workshop, but really it's just sitting down and having a conversation. And I think there's often opportunities at some of the medical conferences for people to become involved and to go along and to talk to other either other patients or particularly to healthcare providers and healthcare professionals, and specifically those who are involved in making decisions about how people are looked after or about particular treatments that might be coming through. And it is invaluable for your voice to be heard at those types of meetings. So I would keep an eye open for these opportunities as well. There are a number of conferences in rare diseases that you can get involved with, and you can have little lunch sessions with. That's there, but just going back to my NMO example earlier, there's opportunity to speak at your local hospitals and to talk to local healthcare teams. And I think particularly with some of the nuances of this specific condition, to just increase and improve that understanding, which will ultimately lead to better treatment. You can get that referral from the consultant. And some of the tips and tricks is try and arrange it for over a lunchtime, and then people are going to come. If you have that referral, they are much more likely to come along and have a conversation with you. You can build a PowerPoint, you can take some materials, but more often than not, it's hearing you speak is so impactful and so powerful and will so help to change the way that, particularly with regard to A&E and how you're treated in that area. It's having that conversation is so powerful. Oh, this was the NMO example that I was talking about. So their foundation, and it's worth, again, I don't know whether anybody looks at other rare disease websites to try and get ideas from there. So this is called the Guthrie-Jackson Foundation, and these were two American entrepreneurs whose daughter, I believe, had NMO, and they've set up this foundation, and they've been going for a little while now, so they've got lots of hints and tips and tricks and tools and resources for some of the individuals to go and have these very conversations. So sometimes it's going about a bit more widely and taking some hints and tips from other rare disease areas. So NMO is quite an interesting one because, as I say, they've been up for a while, and they're very well funded. These American entrepreneurs were actually made an awful lot of money in their respective fields and are ploughing it into this area so we can take advantage of some of their good work. I think I shared most of those tips and tricks when I talked about the Lunch and Learn, but this one, and we'll talk about this in a little bit more, just opening up with that personal story, and I'll keep saying this, personalisation is an absolute attention grabber, because you start to tell that story and people become involved. And last weekend I was with a friend, and she suffers from narcolepsy, and she was talking to me about sometimes when she falls asleep, she'll have all the new bed linen out, and it'll be there, but she'll just fall asleep on the mattress, and you can really visualize that happening, this scratchy mattress, and she's just falling down on it. Or even she says she's had it before where she's just fallen over on concrete on her knees and fallen asleep, and you really then start to put yourself in that situation. So I'm going to give you a couple of tips on how we tell stories in a moment, but try and think about how can you really get this across in as powerful a way as possible. And again, if you've got any brochures or flyers, and you mentioned maybe you speak to the consultant, but it's when it goes to the rest of the team who may not have been there, but if there's anything that you can leave, of course that's going to be very helpful as well. And they are really, really powerful. You can't underestimate the power a story can bring, because it gets that attention. And then what you can do, and hopefully Barclay may have mentioned this, in terms of some of the submissions, if people don't necessarily want to attend the approval meetings, which I understand can be a bit daunting, you can collate some of these sound bites from these various stories and help to get that packaged up. So they're really, really, really valuable, not only in terms of raising awareness, but in terms of potential future treatments as well. So a couple of things, so are you going to share these slides or at the end? Perfect. So it's just some hints and tips, really. What's going to be important? I think particularly when you're speaking, or if you think a healthcare provider might be reading that story, some of the issues with regard to that route to diagnosis. I mentioned earlier work in severe asthma, and oftentimes. These are patients who should be seen by a specialist, but that can sometimes take 15 years. So they will be circling around primary care, seeing a GP for 15 years before they get referred to seeing somebody who should actually be treating them. So we really want to be sharing some of these. That's actually, and I think I saw a couple of eyebrows, that's quite shocking, isn't it? When you think of that is not good healthcare. So all of these efforts can help try to change that. And again, some of the policy work, which will be more conducted at the patient organisation level, but you can become involved with, helps to raise it up agendas. I'm going to share an example a little later of that. And again, when you're telling this story, what have you done? What actions have you taken? Or what do you wish had happened? What could have been different? And how might somebody reading that story, could they gain some advice from that or some help to help their particular situation? What happens on a day-to-day level? When is it particularly difficult? And maybe you can weave some of these elements in, and it really does help to personalise it. And then looking forwards, is there anything that you can add that's going to help others in terms of moving forwards? And This is it's a bit of a trick that you can use. This is what journalists use to ensure that you've covered an appropriate amount of information within your story. If you can put a tick against each of these, you've probably got a pretty good story. Underlaying that with emotion and how it's personal to you, you'll have a nice story there. And I think they're usually about 250 to 600 words if you're writing them down. But again, equally, and as I'm sure Simon's going to talk, you can talk it to camera and tell your story. But any examples of what kind of bits of information might sit under these buckets if we're writing a story?
Who is it affecting? Is it just you as an individual? Is it your family? Is it your friends?
Yes, absolutely.
Does it hit you most, which is every time you sit down to eat something?
Yes. Yeah, when is it particularly uncomfortable? When is it embarrassing? When is it, are you avoiding social engagements? Is it really, yeah, let's think, when is it a real issue?
Always.
Yeah. Yeah, are there any, and again, I think we mentioned it at the back there in terms of diagnosis. What did you have to go through to get a diagnosis? So a few little tricks that can be quite helpful in terms of constructing a story. And again, it really is writing with emotion. I mentioned my friend I met last week, but explaining, try and be simple and clear, but just speak from the heart, and that's what's going to get people to want to read it. We talked about key to finding a diagnosis, and again, we're often a bit too British. Don't be stoic about it. Don't sit there and say, it's fine, I manage, I cope, I'm absolutely okay, it's not a problem really. This is the opportunity to say, actually, no, there is more to it than this, and I do want that to be heard, and I do want people to understand and recognise why that's the case. I'll share the haemophilia one in a moment, but they talk about, it's almost they become, they call it disability accepted. It's almost, it becomes disability normalised, that's fine, that's just the way it is. And again, as we said at the start, well, that doesn't have to be, and that shouldn't have to be the way that it is. And it is just beginning that journey and make it, and once you do one thing, actually that wasn't too bad, it becomes a bit easier to do the next thing, and before you know it, you might be standing up at a medical conference talking about the condition. So, but equally, if you just do one thing, then it's all helping. This is just an example from, obviously, breast cancer has a huge amount of awareness, but it wasn't always the case, and particularly in the instance of advanced breast cancer. And sometimes when we work in rare diseases, we'll look at other conditions to see, well, what it could look like going beyond. So, and these were women who, but oftentimes it was ladies who, and they were left. There's not much we can do. And so actually, hang on a second, no, there is a lot we can do. And there was a big campaign called Here and Now, which was about, again, providing power to that voice, all about that helping raise awareness. So I know it probably sounds easier in an area such as a cancer, which is much more widely known. But again, it's, well, can we take any little tips or tricks from this, or view some of the videos and think, actually, I could apply that here, this would work quite well. This was some of, I talked about that stoicness, and this was an awarded campaign actually, where there was some articles written and talking about, they had an installation artwork, and it wasn't the cancer that was defining them. I'm more than this. I'm still the person I was. So that's all things that we can do as an individual, but of course, we have each other here, and we have the patient organisations as well. So there's a bit more that we can be involved in as part of that, that wider organisation, be it as we talked about, or we will have talked about hopefully during Barclay's presentation, that advocating for drug access when drugs become available and ensuring that they are reimbursed and you do have access to them. Involvement in research, and quite often now companies will be bringing patients in when they're designing clinical trials, because they need to ensure that it is being set up in the right way, such that I guess it's solving the right problems. And I think particularly when we talked about reimbursement decisions and quality of life, for example. What is being measured in terms of quality of life? What does quality of life mean in this area? And oftentimes the company that's developing the drug isn't necessarily best placed to ask that question. It can be more in discussion with people such as yourselves to think, well, what does quality of life look like, and what should optimum quality of life be? Advocating around legislation, and again, it's that the power of many voices and bringing opinions together and submitting that to ministers in health to raise awareness of this condition up the political agenda, try and increase funding, try and increase support to healthcare systems such that we can have more optimised treatment. Patient care services, and again, it's going back to the severe asthma example, there's not enough clinics and there aren't enough healthcare professionals with the knowledge to look after these patients. So it's trying to ask for more assistance. And by combining this together and through the work of the patient organisations, we can bring your voice to that to make that happen. So I talked about what happens at conferences, and going back to the haemophilia example from earlier, so this is a European Haemophilia Consortium which brings together patient organisations in haemophilia from many different countries to a meeting. And one year it was taking place in Romania in 2013, and they talked about if they could change attitude towards providing patients with treatments, it's not only life-saving, but also it's preventing disability. And I talked about earlier about that. This is normal. That's just what happens. No, it's not normal. And what they actually managed to do was the Romanian Ministry of Health, there was a minister there, and they got his actual signature during that meeting to say that they were going to change the way in which haemophilia was treated in Romania. So these can be very, very successful. There are many, many examples of how patient voices, of how results from patient surveys have helped to change the way in which conditions are treated. I talked a little bit about research earlier. This is for amyloidosis, which is they get excess protein in various organs in the body that shouldn't be there, and it ends to organ failure, and it could be anywhere. And what they wanted to do was they ran a survey to ensure that when they were setting up and developing treatments, industry actually had a guide and had some notes as to how they can better formulate their clinical programs. So it's very, very important to collate this information to ensure that the clinical programs had every single chance of success. Again, importance of surveys. So if you do receive a survey, or if there's a part to become involved, do fill it in, and fill it in honestly. I'm just going to share a couple of these tools that are available and websites that you can go to. Has anybody been on this site, Global Genes? Jill's nodding. Anyone seen this? This is wonderful because it has what's called a rare toolkit. So it's a toolkit for raising awareness, really, in rare diseases. And some of the things that I've been talking about today, they've got much more information, so more information about storytelling, as we talked about, and why it's so powerful, how you can write that story, and as Simon, I'm sure, is going to touch on in a moment, how you can get that story out there. And it's so much easier today in our world of social media to get that story out there quickly and effectively. But there's lots of top tips about this. Talks, and you may not have heard of disease registries, and there was a couple we're not too sure. There's lots more information, very accessible, written for patients. So I'd strongly recommend you have a look at that one, Global Genes. And then this one is Eurordis, which is specifically for rare disease, and I'm sure you've been on this many a time. They have one. Yes, fantastic. So there is one for diseases and rare diseases. But again, there's an awful lot of information that's available there, opportunities to be involved, things, tips, tricks that you can take to incorporate into things that you might be doing. And as I say, we talked about it, Doreen said earlier, it's just begin really, and it can start really small, and who knows where it's going to lead to.